How you doing? My name is Gianni. I'm your student physical therapist today. So today what we're going to do is we're just going to look at just your spine, see how even it is. Then I'm going to test out, see your range of motion in that area. And then we're going to do a muscle test. And then I'm just going to, palpate a couple things on your body just to identify some landmarks. Is that okay?
Right.
First, I'm going to start off, if you could stand up for me, please. And I just want you to face the window here. And is there any way I could just pull this down just a little bit? Perfect. Okay, so now what I'm looking at is the iliac crest, which is right in here, this area. And I'm looking at that. I'm looking at how even it is. And from my angle here, it looks very even. And then the PCIS, which would be down here, just distally, and then I feel these two bumps in this area here, these little crests, and looking at that as well, that looks nice and even, so don't have any concern there. Obviously, if it was one way or the other, we'd have concerns on some of those vertebrae and kind of what's going on there, and we check out some of her other things above and below to try to figure out what's going on there. But they're symmetrical. Okay, good. So what I'm going to have you do next is I'm just going to kind of look and see how your spine's moving. So what I'm going to have you do is I'm going to have you face the door here, and all I want you to do is try to touch your toes straight down. Good, and then back up. Any pain with that?
No.
Okay, we'll go one more time there. Down and back up. Good. So quality of motion looked good. Looked like she wasn't compensating, wasn't using too much of the thoracic or the cervical. So that looked good, and then range of motion looked normal. So what I'm going to have you do next is I'm going to have you do extension. So what I want you to do is hips to the side, and then we're just going to extend back like this. You don't have to move your head as much, just trying to isolate that back. Good, and then back up to the top. Any pain with that?
No.
Okay, and then back again. And then, okay. Does that feel okay?
Yeah.
Yeah, your range is fine. I mean, usually you're not going to get as much extension as you do flexion coming forward, but that felt okay?
Yeah, it did.
Perfect. And then if you want to face me, what I'm going to have you do here is I'm just going to have your hands by your side, and then you're going to go as far as you can this way, and then as far as you can the other way. Good. Any pain with that?
Nope.
Awesome. And then one more time, range of motion. Good there. Yeah, both, they look pretty even, and she was getting that quality of range. And then the last one we're going to do, if I could have you take a seat right there, what we're going to do is I'm just going to have you rotate one way and then rotate the other. And then rotate the other way. Good. Any pain with that?
Nope.
And then quality of motion looks good there as well. So that would be normal, no abnormal findings there. Okay. The next thing I'm going to have you do is I'm just going to have you do a muscle test. We're going to test some of those core muscles, okay? So what I'm going to have you do is I'm going to have you lay down here. Good, okay. And is it okay if I'm just kind of touching in here just to feel your muscles activate?
Yeah.
Sorry if you're a little...
That's okay.
So what I want to have you start with is start with hands behind the head. And then what you're going to try to do is you're going to try to do a sit-up.
Okay.
Not moving your legs at all. And I just want you to try to lift up your scapula without moving anything else. No legs involved. And I'm going to palpate here just to make sure. Okay?
Okay.
So whenever you're ready. Good. And then back down. One more time. Good. And back down. Okay, so we're looking for that inferior border of the scapula coming up. And from what I saw, it looks like she had it. So that'd be a 5 out of 5 on the manual muscle test grade. A 4 out of 5 would be if she wasn't able to do it and we had to cross her arms and she was able to do that up. And then a 3 out of 5, she would have to have her hands by her side and then lifting up. And then a 2 out of 5 would be she's only able to lift head and neck up. 1 out of 5 would be is if she couldn't lift anything up, and but I could feel a contraction. And a 0 out of 5 would be is if she tried to do the movement, I couldn't even feel a contraction in her abdomen there. Okay. So last thing I'm going to have you do today is I'm just going to, like I said, identify a couple bony landmarks like I talked about.
Okay.
So is there any way you could stand up and turn around for me?
Yep.
So what I'm going to do first, yeah, perfect, if you can, I'm just gonna identify T1 here. So if you could just kind of tilt your head forward and then come all the way back. So like straight, and then again, one more time. And again. Okay, good. And then I have T1 right here. You see that? And then keep going, just keep doing that. And then there's T2, T3, T4, and then T5 right in there if you could see it. Good. Okay, that feel okay?
Yeah.
Okay, now I'm going to look at the transverse process of a lumbar vertebrae. So what I'm going to have, I'm going to identify the iliac crest here, and then that would kind of be in that L4, L5 spot. So looking from the spine, I'm just going to go out a little bit here. And is it okay if you just rotate like you were doing sitting down? Good. And then I feel that going away, in. So when she's coming towards me, I can feel that transverse process poking into my thumb, and when she's going away, I feel that disappear on my thumb. And then the last two things I'm going to have you do is I'm going to have you lay back down, if that's okay. And then we're going to identify the ASIS. This is going to be a little tough with here, but what I want is I just am feeling for that iliac crest here, and then just kind of following it in. Is this okay if I touch it here? And then it's going to be right in this area here, so I can feel that bony prominence right in there, and that would be the ASIS. So it's inferior and then medial to the iliac crest. And then the last one I'm gonna do today is I'm gonna palpate your xiphoid process. So what I'm gonna have you do is just with your chest, if you could just hold that up for a second. Is it okay if I go just right here? And then right here, I can feel that distal border of the xiphoid process here at the bottom here. And then that is it. Thank you so much. I appreciate it.
Thank you.